Your feet can kill you. Yes, you heard that right. Your feet may actually be the most silent danger in your body, especially after the age of 60. It may sound like an exaggeration, but think about it. When was the last time you really paid attention to your feet? Yet with every step you take, every surface you step on, that's where your age affects you the most, your feet. Research shows that more than 30% of people over the age of 60 lose their mobility due to foot problems. This can lead to falls, injuries, and even fatal complications. In this video, you will learn what happens to the feet as we age, which symptoms put your life at risk, how your feet can give away other diseases in your body, and of course, what you can do to prevent them. And we'll talk about it in a simple and conversational way without medical jargon. Because health is serious business, but the tone can be friendly. If you are over 60 or have someone in your family in this age group, I strongly recommend you to watch this video to the end, because sometimes survival starts with how you stand on the ground. Let's get started. Aging is not just about graying hair or wrinkled skin. In fact, one of the places that change the most as we age is our feet. But for some reason, not many people talk about it, right? Think of it this way. We walk an average of 160,000 kilometers in a lifetime. That's like walking around the world 4 times. As such, it's inevitable that our feet wear out over time. So what exactly changes? First of all, the skin becomes thinner. This weakens the skin's defenses against external influences. Even a small scratch can become a risk of infection. Circulation slows down. When blood does not reach the toes sufficiently, wounds heal more difficult, nails break easily, and skin discoloration occurs. Fat tissue decreases. The support on the soles of the feet, which used to protect you like a soft pillow, is now almost non-existent. This makes walking painful. And most importantly, nerve endings weaken, especially if you have chronic diseases such as diabetes. These nerves deteriorate over time. So even if your foot is cut, you may not feel it. According to the Mayo Clinic, about 30% of people over the age of 60 experience numbness, tingling, or burning sensations in the feet. This is not only uncomfortable, but also dangerous. Why? Because you may not realize you have a sore on your foot. It gets infected, doesn't heal, and can eventually lead to more serious health problems. These changes are insidious. Today you may pass it off as a little heel pain. Tomorrow you fall because you can't feel the ground you are stepping on. So aging is natural, but knowing about these changes and recognizing them early makes a huge difference. Next, we'll talk about what dangerous signals these changes give and which signs should never be ignored. Are you ready? Now think like this. You have a wound on your foot, but it doesn't hurt. A little redness, maybe a little bruising, but you ignore it because there is no pain. This could mean that you are unwittingly taking a big risk, because there are some symptoms, seemingly simple but actually vital signals. Let's take a look together. What could your feet be telling you? 1. Discoloration. Have you noticed bruising, pallor, or a bluish tint to your toes? This often indicates that there is not enough blood flow. This is especially common in people with peripheral artery disease. Blood cannot reach the feet, and the tissues are deprived of oxygen. In the long run, this can lead to gangrene. 2. Numbness or tingling. My foot feels numb, but it won't go away. If this sounds familiar, it could be a sign of serious neuropathy. This is very common in diabetics, but it is not unique to diabetes. Nerve compression, vitamin deficiencies, and some nervous system diseases can also cause this feeling. 3. Wounds that won't go away. A simple wound, but it doesn't heal for weeks. This can be a sign of poor circulation or a weak immune system. According to Harvard Health, non-healing foot wounds are the most common cause of foot amputations in people over 60. Swelling. If your feet are normal in the morning but swell up like balloons in the evening, it may not just be related to eating salty food. Heart failure, kidney problems, or lymphatic circulation disorders can cause this. 5. Pain. Pain that occurs especially when walking and then goes away when you rest. This can also be a sign of vasoconstriction. If you have cramping pain in your legs, this is a warning that should be taken seriously. In short, these signals from your feet may not just be a foot problem, but a cry from your whole body. Remember, often these symptoms are silent at first, but if you recognize them and take precautions, you can prevent major health problems. Now we are going to dig a little deeper. We will see how these symptoms can be the first harbingers of larger systemic diseases, because the body never signals randomly, especially the feet. Now, a very simple question for you. What happens when you have a problem with your foot? The answer is actually very simple. I find it difficult to walk. But here's the truth. You fall. And with age, a fall comes with life-changing consequences, not just a bruise or a fracture. According to the World Health Organization, accidental falls are one of the most common causes of death in people over 65. And most of these falls happen inside the home, on familiar ground. And why is that? Because feet are no longer reliable foundations. Look, what we call balance is the result of three systems working together. Musculoskeletal system, balance organs in the inner ear nerve, endings in the feet, but as we get older, muscles weaken, nerve endings lose sensitivity, because the sensation in the sole of the foot is reduced. The brain cannot correctly perceive how you step on the ground. This is exactly why tripping on a carpet is not a simple thing. Loss of sensation in the foot, plus weak muscles, plus slow reflexes to fall risk. And believe me, it only takes a second to fall, but to recover, it can take months. And sometimes you never fully recover. Hip fractures, brain trauma, long-term bedriddenness. Some people even stop walking altogether after a fall. So what can be done? Knowing the impact of your feet on your balance and recognizing weak points early is the first step to prevent falls. In a moment, I'll tell you how you can prevent falls and what exercises and foot care techniques can reduce the risk. Because remember, getting older does not necessarily mean falling. But if you don't take care of your feet, it's not age that makes you fall, it's neglect. Now, I am going to tell you something that may seem a little strange. Doctors can sometimes tell what diseases a person might have just by looking at the feet. Yes, the feet are a kind of health map, because some diseases first show symptoms on the feet. Which diseases? Let's take a look together. 1. Diabetes. If there is burning, tingling, numbness in the feet, this may be a sign that your blood sugar has been uncontrolled for a long time. This condition, called diabetic neuropathy, slowly kills the nerves. In addition, wounds on the feet that do not heal, dry and cracked skin, fungal infections can also be among the first symptoms of diabetes. 2. Circulatory disorders, peripheral arterial disease. Are your feet cold? Are they pale in color? Do your nails thicken and break easily? These are signs of poor blood circulation. Blocked arteries in particular prevent enough oxygen from reaching the feet. And this can also be linked to heart disease. 3. Rheumatic diseases. If you have stiffness, pain, or swelling in your feet when you first wake up in the morning, this can be a sign of inflammatory diseases such as rheumatoid arthritis. These symptoms usually start in the hands, but the feet are also often affected. Thyroid disorders. If your feet are constantly cold, your skin is dry and pale, your thyroid gland may not be producing enough hormones. 5. Liver or kidney problems. If you have constant swelling in the ankles and feet, this could be a sign of fluid retention in the body. Such edema occurs when the liver or kidneys are not working properly, so sometimes just the color of your toenails, the shape of a callus on your foot, or even a wound can tell you what is going on inside your body. The interesting thing is that often when these symptoms are recognized and you ask, is this normal? It is actually a chance to intervene at the first stage of a serious illness. Watch your feet. They sometimes speak before your tongue. In a moment, we will talk about how you can protect your foot health and what precautions can be taken. Because it is important to know what they signal, but responding to those signals correctly saves lives. Now let's talk to you seriously, because all the symptoms we have just talked about, if they are not recognized, or if you say, oh, it's nothing, do you know what the consequences can be? It can be catastrophic. And here's the tragic part. Many of these disasters could have been prevented. For example, 1. Foot amputations. Many people with diabetes who do not pay attention to their feet lose their feet because of a small wound. Because the nerve endings cannot feel it, the wound goes unnoticed, the infection spreads, tissue death begins, and eventually it has to be amputated. Approximately 80,000 diabetic foot amputations are performed each year in the United States. Moreover, most of these people were not even aware of the wound. 2. Hip fractures due to falls. Hip fracture after a fall in the elderly is often the beginning of bedriddenness and depression. 20% die within the first year. One fall, but a cascading health catastrophe that lasts for years. 3. Sepsis and vital infections. If a simple foot infection is left untreated, it can enter the bloodstream. This is called sepsis and can be fatal without immediate intervention. 4. Loss of movement and social isolation. Many people with foot pain avoid going out. The moment you say, "My foot throbs when I walk a little," you take a step back from life. Over time, this triggers depression, muscle loss, weight gain, and many other health problems. But I repeat again, most of these things would never have come to this point if they had been recognized and prevented in time. In other words, it is not a matter of "I have some pain in my foot." It's about whether or not you read the message your foot is giving you. We're going to talk about what to do, how to prevent these problems, and which routine checkups can save lives. Because this video is not just for information, it's for action. Let's look at solutions together. Okay, now we know how critical foot health is, but now we come to the most important question: how do we maintain it? The good news is that science gives us clear answers. Here are the most effective ways to keep your feet healthy. 1. Do daily foot checks. I know most of us examine our face in the mirror, but how many people check their feet every day? Especially if you are over 60 or have diabetes, you should check your feet every day. Are there any cuts, sores, or discoloration? Any swelling, inflammation, or tenderness? Is your nail color normal? If you notice anything, consult a specialist immediately, because a problem recognized early can be solved before it grows. 2. Wear the right shoes. The wrong shoes are the worst enemy of your foot health. Make sure that your shoes do not pinch the toes. Wide-toed shoes should be preferred, especially for diabetics. Choose shoes with good arch support. Orthopedic insoles reduce pain by distributing pressure evenly. If possible, wear shoes without heels or with low heels. A high heel puts excessive pressure on the joints of the foot. 3. Strengthen foot muscles with exercise. Your feet should be strengthened just like any other muscle. Here are some effective exercises that are scientifically supported. Ankle twists. Improves blood circulation and increases flexibility. Grasping the towel with the toes. Strengthens balance by working the small muscles on the soles of the feet. Heel and toe walking. Reduces the risk of falling by strengthening the muscles of the soles of the feet. Even doing these movements for 5 minutes every day makes a difference. 4. Increase blood circulation. Poor blood circulation slows down the healing process and can cause numbness in the feet. To prevent this, take short walks every hour. Sitting for long periods of time slows blood flow. Sit without crossing your legs. This can block blood flow. Use massage and hot and cold therapy. Even a light massage can increase blood circulation. 5. Be careful in nail cutting. Cut your nails straight, do not round the edges. This prevents the formation of ingrown nails. Use hygienic scissors or nail clippers. This reduces the risk of infection. If your nails are thickened, seek help from a podiatrist, foot specialist. Fungal infections in particular sometimes go unnoticed but can spread if left untreated. 6. Moisturize but not in between. Moisturize the soles and heels of your feet. Dry skin cracks and becomes open to infection. But don't apply cream between your toes. Too much moisture invites fungal infections. 7. Make your home safe to prevent falls. Eliminate slippery carpets and cables. Review everything that is at risk of falling. Make it a habit to turn on the light when you get up at night. Moving in dim light is dangerous. Use bath mats and slippers with non-slip soles. 8. Have a foot checkup at least once a year. If you have diabetes, circulatory problems, or rheumatic diseases, you should see a podiatrist or orthopedist at least once a year. By detecting changes in the feet early, experts can prevent major problems. Remember, if you neglect your feet, they can one day become the weakest part of your body. But if you follow these steps, your feet will continue to be a solid foundation for many years to come. Well, now I'm going to summarize all this information and share the most important message of the video, because the biggest difference is not learning this information, but applying it.